Hello and welcome to this episode of the Pure Pod, a podcast brought to you by Pure Sports Medicine. My name is Tom Ritchie and I'll be your host. Amy has worked as a physio at top football clubs including Chelsea, Fulham and Crystal Palace, where she spent over a decade developing her expertise in treating lower limb injuries. She has a passion for optimising performance in women and youth athletes, guiding their return to their chosen sport. Natasha also has a wealth of experience in professional sport, serving as the head of medicine at Swindon Town Football Club and as head physio for North Harbour Women's Rugby in New Zealand, and after she called time on her own elite rugby career. Her passion also lies in working with female athletes. She believes in taking a holistic approach to patient management, focusing on both the physical and mental aspects of injury and rehabilitation. Hi, Amy. Hi, Natasha. Thanks so much for joining us.
Thanks for having us.
So, Amy, I'll come to you first on this. I think probably the best place for us to start is to talk a bit more generally about the role of the ACL within the knee joint. So, what function does it carry out within the joint, and specifically for athletes, what type of movement does it facilitate on a rugby pitch or a netball court, for example?
Sure. So the ACL is a very important ligament in the knee, and it's a key stabilising ligament. So what it does is predominantly it stops the lower leg, so the tibia, the shin bone, sliding away from the femur, so the thigh bone. So that's called anterior translation. So we obviously don't want the tibia to slide too far away. Another role of the ACL is to provide stability during rotation, and it also provides proprioceptive feedback to the brain. So it can tell the brain where the knee is in space. So
it's got a lot of kind of nerve endings and receptors in it that help that feedback loop and can modify where the joint is in relation to kind of where the rest of your body is and to different stimuli that's coming at you.
And Natasha, is there any specific sports where there is a greater risk of ACL injury?
Yeah, so based off what Amy said, if you think that it's there to provide the stability, so anything that is kind of a reactive sport, so you're looking at your netballs, your footballs, tennis to an extent, rugby, skiing, anything where there is that torsion on the knee. Most of the injuries on your ACL are coming from non-contact injuries. It's about 70 to 75%. When you're landing, when you change your direction, when you're decelerating, and then the other aspects will usually come from a lateral blow on the knee in things like rugby, maybe even in football. So you have that mixture of contact and non-contact sports, but it's usually the more dynamic sports where you're reacting to not only your own body stimuli and landing from heights and jumping, but also to other people on the field of play.
Mm-hmm.
And recently, the prevalence of ACL injury, specifically in female athletes compared to men, has become more widely known. I'm specifically probably thinking about in the build-up to the 2023 Women's Football World Cup. There were 30 or so players who were missing that tournament because of an ACL injury. What does the most recent research suggest is the reason behind this affecting female athletes more than men?
Mm-hmm. So I think this is quite a popular area of discussion
definitely
at the moment. So obviously there's a lot more recent evidence and research going on around like hormonal changes. Obviously men and women have completely different hormonal profiles. They also have completely different anatomy, well, to a degree, variations within their anatomy, as well as kind of the effects on their biomechanics as well.
Yeah, I'd agree. I'd say that as opposed to there being like a general consensus from the research currently, it's almost more that we don't know. We don't know what that reasoning is, that there is a higher prevalence. Like you said, it's between 2 and 8 times higher in a female that they're more likely to rupture their ACL. I think FIFA did a study this year, I'm pretty sure, and it was something like there was a 1.6% chance of in the men's Premier League this year of a ACL rupture, and there was a 5.6 or around that number in the females Women's Super League. So that's quite a big difference to have. So we know that there's that difference there, but I think there's a whole kind of variety of things that are leading to that. We can't just go, it's because of that hormonal change, or it's just because of your Q angle or your biomechanics or something else being different. I think there is a lot of different things that we know are probably impacting it, but the research isn't there to suggest what is actually either how you then say this is our number one and this is where to go through. And obviously you were saying the hormonal factor, that is a massive thing, or a massive hot topic in the media, I'd say, at the moment. And rightly so. It's probably the biggest determining factor between what makes you a male and your female is your sex hormones. So it does need to be studied, but is it the only factor? In my opinion, like, absolutely not. So
I think it's just nice to see so much more chat around menstrual cycles and hormone, hormonal profiles in general. I think it's just an area that even women actually have known such little about for a long time. Absolutely. Really, it's not actually discussed to too much extent at school and as you're growing up, and actually there is quite a gap in the knowledge there. So it's really nice to see so much research and evidence coming out, but as you said, it's quite inconclusive at the moment, largely because it's very hard to control.
It's so difficult.
Different factors of the menstrual cycle. Everyone has a completely different, individual cycle and response. Some people are very sensitive to changes and fluctuations of hormones. And everyone's cycle is very different in terms of length and presentation. So,
and if we're looking at the cycle, it is the estrogen and the relaxin that are the two hormones, I guess, that we'd be looking at potentially making an impact on the ligament laxity. And that's, if you're going to go down the scientific route, to look more at kind of the type 1 collagen fibres and how they synthesize and how that kind of supports the ligaments and the tendons themselves. And that is obviously fluctuating constantly throughout anything from a 28 to 35 day cycle. But that's not always the case in females, that they have that normal cycle, and even more so in female athletes, that a lot of females actually are anovulatory. A lot of females are amenorrheic and don't actually have a menstrual cycle at all.
And then it's sometimes in specific sports that can be quite common as well, right? Because of the demands of your body in that sport. So, for example, maybe something like gymnastics, where you have to have a very low body weight. Is that something that could be a factor?
Yeah, definitely. So and we were chatting about this before, actually, that the sports that were historically, shall we say, more feminine. So your gymnastics, your ballet, and that had that more aesthetic kind of factor to them as well. Low BMI is a factor in because it's not the only factor. You can be overtraining or under fueling and have that mismatch of balance, but but having the pressure of looking a certain way for your sport, not just performing a certain way, will massively have an impact. So, yeah, and hopefully, I think you'd agree that there has been a change recently. There's the whole strong not skinny movement, and you have athletes like Iona Merher in rugby at the moment.
Massive, isn't she?
Huge, absolutely huge, and she's the most followed rugby player in the world. Yeah. And what she's doing on her platform to go, actually, my body it's a hell of a vessel for me to play rugby, and I'm strong and I'm really bloody good at this, is great for people to see. And so there has started to be that shift, but I don't think we're quite there yet.
Yeah.
Do you agree?
Yeah, no, definitely, I agree. I think there is just so much variation between different cycles, as we said, also different women's health presentations. Are people suffering from endometriosis? Are they suffering from other women's health conditions? Not to mention pregnancy, menopause, perimenopause. It's a bit of a minefield, really, when you actually start to break it down and delve into it. So hopefully we'll be able to get closer to pinning things down, but I guess the school of thought is more to do with kind of the peaks and troughs of the fluctuations. More like a bigger crash will maybe create greater ligament laxity. However, that's not the same for everybody. Some people are more sensitive than others. Some people have really stable collagen. So that's kind of where the school of thought is going. But again, it's inconclusive as to what part of the cycle it's in for the moment.
And I think that because it is so inconclusive, the biggest takeaway is for each individual female to know their own cycle. It's mine's not the same as your cycle, and it's if you can track and monitor your own response, your own recovery, your own feelings, your energy levels, all of those little things, you'll have a much better understanding of your own body as well. And like you said, we weren't taught that at school.
Yeah.
It wasn't mentioned once in my degree.
I don't think I even knew there were 4 phases
No.
when I was younger.
Exactly.
Well, when I was older, to be honest, it took a while.
So it's refreshing to see that it's starting to get there. But and like we said, it's just one part of why that female male.
And if you think about it as well, rather than actually looking into the science of the hormones, if you actually just look at the bigger picture as well of how people feel at different times of their cycle, whether they're lethargic, whether they're, unable to sleep well at night, and all these different factors can also have a larger knock-on effect for higher injury rates as well.
Yeah.
And
Definitely.
reduce readiness for activity.
Yeah.
So it's not necessarily that you can pinpoint to a point in the cycle and say that you should modify your training to minimize risk. Is it more just kind of being in tune with what your body is telling you and just adjusting accordingly, maybe?
I'd say yes. There is a lot of studies. There is studies that have been done, and there's more studies currently being done. And I'm not going to hang my hat on anything at all here. That would potentially suggest around kind of your ovulatory phase, when your estrogen and your relaxin levels are high, that you might be more at risk of ligamentous injuries there. But nothing has been completely set in stone. And if you look at a few different studies, they'll be quite different. There's been some done in football. I did one in my MSc in rugby in New Zealand, and I found something quite different to what they found in FIFA over here, but similar to someone else's. And actually, one of the big things was that because it is such a minefield to study, there is no generalised consensus on how we collect data of a female athlete, because it's difficult. If you collected data from me on day 1 of my cycle and day 28, you're going to get really different outcomes. So from that, you can't say, let's not play that player during her 3 days of ovulation, because we don't have the conclusion for that as of yet. Whereas actually being in tune with your own feelings and, like you said, are you recovered? Have you slept? What's your nutrition like? What's your readiness like? That's probably a better indication of performance and injury risk.
I'd say from the athletes that I've worked with, the biggest indicator is maybe just more a subjective feeling. So whether it's like confidence levels as well, have they had ACL injuries before? I've worked with a player that had 3 ACL injuries, unfortunately, and she just really felt that at certain times of her cycle, she didn't feel confident to do X, Y, and Z. So she might modify her training according to her. We'd have others that felt in different times of their cycle that they needed longer to recover. So we might implement different recovery strategies. And you had other players that just really didn't want to know anything about it. They didn't want, to have any interference psychologically as to where they are in their cycle, and they weren't interested. So it really is very much dependent on the person.
That individual response.
And we touched on it a little bit there, that there are also some societal factors involved in this. Like, obviously, we've mentioned what I think you described as like aesthetic sports that women might have been pushed towards in other times, like gymnastics, ballet, but then also access to better facilities, access to the right kind of equipment. I mean, there was a working theory at one point that football boots weren't correctly engineered for women, and I don't know if there's been research into that, but there's all of these various things that just make it a bit hard to kind of pin down, right?
Yeah.
I think all you have to do is walk into a gym, right? And then you'll see that, half the women can't even fit on the extension machine or the hamstring curl.
Absolutely.
And even when you adjust it, as far as it goes, it still isn't quite the right size for a female. So you've got the gym equipment, you've got the footwear for sure, like throughout all of the clubs that I've worked at, that, unfortunately there is a difference in budgets and accessibility, resources.
Even down to like playing fields.
Yeah.
It's at the women's premiership level. I know I keep going back to rugby, but that's kind of my safety net,
I'm comfortable
my niche
there as well. Yeah, I'm good there, yeah.
But you look at where the elite women are playing, and sometimes they will play at, Kingsholm or Ashton Gate or different places like that, but not always. They might be playing at a lesser field, and that will have we know that playing surface has an impact on that. So the facilities on the field and off the field are going to have an impact on not just ACL injuries, but on other injuries as well.
Even if you look at like times of training as well, like maybe for the youngsters, you'll have potentially the younger boys will be in full-time education at the training facility, whereas, you know, the females might have to take the evening slots after school or whatnot. So, you know, it's just a matter of how advanced the sport is, really, isn't it? So, you know, much more has gone into the men's game in a lot of these professions. And that's probably just historically because, you know, women did start a lot of these sports at a lot of a later time than men. They just haven't had the chance to progress, build the budgets, build the exposure that the men's games have.
Yeah, and the professionalisation, I guess, of that men's game compared to the females' game is also... has had a big impact on it. That, like you said, women are training often after working hours. So they've done their normal career that they have, and then their training of an evening, and then they're still working that 5 days a week, and then they play in the highest level, the highest division of rugby that they can play, or second highest division of football that you can play as a semi-professional or still amateur athlete, but they have also worked a 9 to 5 or whatever it is now for the rest of that week. You also then add on top of it, which is fantastic, but the amount of players that are now mothers and have families, which I completely rate and support, and fair play to them to be able to get back to that. But that is another societal thing that I guess adds a little bit more pressure. It was the other day we were watching Samoa in the World Cup, and the commentator said, one of the players, she's got 4 children at home. And I was thinking, sorry, what? Like, she's a school teacher and she has 4 children at home and she's playing in the Rugby World Cup. Like, absolutely hats off to her. But is she an injury risk waiting to happen? You know, there's all those other bits that we don't always have to consider. I'm not saying that we never have to consider them in the men's game.
I think if you're looking at professional level, for sure, number of resources, finances towards resources, tracking, equipment, all of the access to all of those things. But if you're actually looking back to the general public, when we do build all of our neuromuscular control and take advantage of our learning potential and neuroplasticity, is back when we're actually in our mid to early teens. And realistically, if we look back at when we were at school, I think I was probably one of the only girls in my class that loved PE. Most of the girls would sit out or didn't want to do PE. And I actually think a large part of that does come down to confidence. It comes down to like the picture of, what is ladylike if you're going back in the day. You know, it's really has a very different starting point. For men or for boys, it's, straight onto the football pitch. Like you said, for girls, it's, maybe going into swimming back in the day. So really just that layer of baseline, girls maybe aren't brought up to think, I better start lifting weights. I don't want to look too bulky. Whereas actually guys, it's, that's the first
Get in
direction.
the gym straight away.
So the starting point of baseline is very different.
Yeah, the training age, I guess, the training age for men and women now, because that's where we were societally when we were a bit younger. It'll be interesting to see if that changes over, with all the role models coming through in the women's sport now, whether younger girls are playing football in the playground and doing those things, but completely agree that that has to have such a big impact on, like, you exposure at a younger age.
I do like to bring it back to doing the girls proud. When you look at, female football back in the day, it was actually females that were prevailing in football, I believe, before the war.
Yeah.
And then there was kind of this shift where, women were thought that maybe it was a bit unsafe and discouraged from it.
Yeah.
The men's game obviously then got a chance to really progress.
We paved the way.
And, women are now catching up, not because we're not as good, it's just we, had a little bit more of a delay in our ability to progress.
Yeah. Absolutely.
We touched on briefly the biomechanical patterns that might be a factor as well. Could you maybe explain those in a little bit more detail, Natasha? Like, what are some of the risk factors involved? Yeah,
so biomechanically, we are built differently than guys. So we have a thing called a Q angle, so a bigger angle from the pelvis down kind of towards the knee, which can create a more valgus force, so where the knee kind of drops in ways. If you think then we've said, like, your landing mechanics and your rapid deceleration, that's affected by our Q angle. And that's not something that we can we can't change, but is something that we can train around with the right, like we said, strength and conditioning programming. Naturally, our strength is relative to BMI is less in women. Again, is that because we are less exposed to these things when we're younger? But actually, there is studies that show kind of 8-year-olds have a lesser hamstring definition in females than they do in males. So, it's you got to question that a little bit. And we are naturally more quad dominant as females versus males. And we know that muscle imbalance between kind of quads and hamstrings, that anterior posterior balance, will impact the stability of the knee and then the ACL.
I think that's the key, isn't it? Where women's hips are generally a little bit wider, obviously for a reason, for childbirth and everything later on. That angle, as Natasha has mentioned, will get the femur to point inwards towards the knee, and that angle can create quite a lot of strain on the ACL. If you actually go back up the chain, the kind of torque that it creates on the trunk is actually higher as well. Women tend to have a higher centre of gravity as well, so the kind of shift on the trunk is higher in women. And actually, if you think about sports bras, women who might have heavier chests, actually that can also have more of an effect on your ability to stabilise as well.
I think, again, this is going to be sport specific, but is there any kind of strength and conditioning tips that you can give people who are maybe at higher risk of an ACL injury? We mentioned those sports earlier, where team sports mainly, where you're kind of twisting and turning a lot, so football, rugby. What are kind of the strength and conditioning tips that might help with someone there, Amy?
Yeah, I think it might sound to females that we're at a massive disadvantage, but I think that is absolutely not true at all. And actually, we're just encouraging the differences. So actually, the advantage of women's sport is actually women, are generally very technical and very skilled, whereas men might be able to just, hoof a ball. Okay, that's a bit unfair, but they might be able to, they've got a lot of strength, they've got a lot of power, and actually women can be a lot more technically optimized. So actually, when we're looking at our strength and conditioning, yes, we do want them to be very strong. So within our realms of physio, we have lots of different objective markers that we want our patients who come in with an ACL injury to meet. That might be their objective markers on a handheld dynamometry machine that we use to make sure that they have enough when we're looking at the ratio between their quads and their hamstrings. We also, advance them through their rehab, and we might also finish with some forced decks where we can look at their landing mechanics as well and make sure that they, are as springy and as symmetrical as we would like them to be. We have lots of different markers of how symmetrical we want one leg to be in comparison to the other, and then we can be confident in where they sit in their risk of re-injury and lots of return to sport markers. So for women specifically, given that men generally have much higher peak force and peak speed, we need to make sure we're covering that for women, and perhaps we need to just really, really knuckle down on the neuromuscular control as well. So really making sure that actually we're not excluding balance. We're looking at dynamic stability as well. So introducing plyometrics and making sure that, they're able to land and pivot and twist and things like that.
Yeah, so I think, like you're saying, a big one is quality. It's not just what you're doing, it's the quality of that movement. If we're saying that kind of, even as an injury prevention as opposed to just as ACL rehab, like absolutely with ACL rehab, you need to be guided from someone that, both from anyone with an ACL injury needs to be guided from someone that knows kind of what they're talking about. But as a prehab version of that, and for any kind of girls, women in sport at the moment, I think back to your original question of any tips on strength and conditioning plans or that type of stuff is get someone that knows what they're doing. So get an S&C coach, get someone in the gym. If you're serious about kind of progressing and and just wanting injury prevention stuff, get someone to have a look at your mechanics, get someone to look at your movement patterns and to work out where the potential deficits lie and create a tailorized plan for you to minimize your risk of injury.
A large part of what we do is we look at this kind of kinetic change, so starting at the hips, down at the feet, and you'll set some exercises for someone. They'll go away, they'll smash loads of, single leg sit to stands. Yeah, I'm doing it fine. But actually what they're not doing is looking in a mirror and not necessarily addressing those angles, which is something that we can really help with.
Yeah.
So for someone looking for a more standardized approach to kind of S&C conditioning, generally it can largely be incorporated into your warm-ups. So you've got the FIFA 11 Plus, which is a really well-known program. You've also got the PEP program as well, and I'm pretty sure Aspetar have started to introduce some more templates as well.
So it's that, and they are great ones for a starting point, definitely. And then looking, like we said, at a bit more sports specific stuff, looking at actual kind of weightlifting stuff, getting underload, doing what would be classified as the norm in your male sports as well, to really try kind of build that resilience and enhance your athletic performance whilst decreasing your injury risk.
I think that's quite a big angle of how I approach a lot of my rehab as well. Is women generally do feel quite intimidated going into the gym, or they're not really sure what they're doing, or it can be quite a scary place in the gym. So a lot of what I'll do is empowering women to actually start lifting heavy and answering all of their questions and concerns. And we're quite lucky down at our Rains Park branch. We're attached to a David Lloyd, so we get the opportunity to actually take people into the gym and integrate them. And really encourage that pure strength as well as the muscular control.
I had a patient this morning and been working with her for a while. She actually had an ankle injury, not a knee injury, but working with her for a while. Just had such gym anxiety, just really didn't want to be in there just because of, she said, well, there's loads of men in there and I don't really know what I'm doing. We've been trying to break that down for a little bit of time, and she came in today and she was like, I was in the gym on my own last week, and I was like, amazing. Oh, what a star. So it's like those things, those almost links back into your societal thing, breaking down those barriers and helping people to go, it should be the norm for us as well.
I just wanted to look in a little bit more detail about how you might help somebody who's had a significant ACL injury. So, for example, they might have had a tear and then that might have required surgery. Tash, I'll come to you on this. Is it a case that there are different ways that you would treat a woman than a man in this situation? I mean, I don't know if that's a silly question to ask, but are there any specific risk factors in that recovery process?
It's definitely not a silly question. I personally, and Amy might massively disagree with me on this, I wouldn't treat a male and a female differently post ACL injury.
Okay.
In the grand scheme of things, I guess. To me, every patient that's coming in is individualised anyway. So a male may be coming in and have zero training history and zero, gym history, and was playing five-a-side in a park with his mates and did his ACL and has no interest in going in the gym. So, and a female might come in to me and say, oh, I'm in the gym 6 times a week and I usually strength train, and actually I was playing, I was elite skiing and did my ACL. So to me, yes, sex is a factor and needs a consideration, but isn't the determining factor on how we would plan a rehabilitation program. There would be things that I would consider more. So there's questions that I'd be asking in terms of menstrual cycle and in terms of have you had any children, and endometriosis and pelvic floor and all of those things that I'm not going to be asking a male. And potentially towards the end of the rehab, when we're looking at that landing mechanics and that control, I would be probably a bit more focused on that with the female athlete. But if a male athlete indicated that he had quite poor proprioceptive control or quite poor neuromuscular control, well, then I'm going to address that with them. So I think it's, instead of thinking of them, think of patients as female and male, it's more individualizing the patient and tailoring the plan based off what we have seen for them. Do you agree?
Exactly. I mean, our job is to help people towards their goals. So it depends what their goals are and where it is that they're heading. You're not going to make assumptions, and you're going to go through, all of the screening markers that we need to be looking for. We're going to be checking quad to hamstring ratio in everybody. We're going to be looking at proprioception and neuromuscular control. Correct, for sure. We'd obviously be looking at different subjective questioning. Just, are there any underlying pelvic health, issues that we need to be aware of? something that we look at quite a lot at our branch is relative energy deficiency syndrome, which is quite is much more prevalent generally in women, especially in the types of more aesthetic type of sports that we've spoken about. So if someone is suffering from RED-S, it's basically to do with a bit of a mismatch between the amount of calories that are coming in and energy expenditure, and that can have a bit of a knock-on effect in terms of, you know, the quality of our you know, musculoskeletal makeup and our energy reserves and things like that. So that's maybe something that I might look at a little bit more in a female, but men can also suffer from that as well. So
it's just more difficult to pick up in men. But we're really fortunate at Pure that we've got those services like the RED-S service at Rains and Bank now. But more that hopefully we can help prevent ACL injuries if we are concerned that somebody is in a relative energy deficiency, by addressing that and before it gets to the stage where injury is prevalent. So I know it's the classic, like, prevention is better than cure on all things, but it really is, you know, that yes, some ACLs absolutely unpreventable. If somebody's coming into you and wipes you out, or if you catch your edge when you're skiing, you can't prevent that. That's that's the risk that we take playing sport and doing fun things like skiing. But there are other bits of it that are modifiable and are preventable. And by having, you know, the resources around you, having the strength training, having the education to know what you kind of need to do, should limit your risk. I think.
Again, kind of following up on that, every patient's different, right? But you would come to treating each patient with a team of other professionals around you, obviously in your role as a physiotherapist, but you might be working with an orthopedic surgeon, strength and conditioning coaches, nutritionists. So maybe give us a taste of how you work in tandem with those other disciplines when you're treating someone who's recovering from an ACL injury.
Yeah, I suppose it kind of depends which avenue they come into first. So they come to you as a physio. They've been to an SEM doctor? Have they come in from a surgeon? But essentially we need to obviously first categorise the injury that they've had, and then share with them kind of their options. Do they want to actually treat the ACL non-surgically with the cross-bracing technique, which is a much newer kind of novel approach?
We're doing that down at Rains.
We are doing it at Rains, yeah.
What is that?
So
here we go.
There is now a third option. So you've kind of got back in the day, it was, you know, straight to surgery, you know, first approach. Then we've kind of had much more evidence to suggest actually there is spontaneous healing of the ACL, which we never thought could be the case previously. So now we kind of have more of a collection of people that would just go the rehab only. Now there's kind of a third option, and there's a particular criteria you need to be able to meet. But if you can meet those criteria, we can do the imaging and make sure that diagnostically things are going to leave you a good possibility of healing, and then we can actually put you in a brace, which unfortunately is at a 90-degree angle. So it is quite a challenge, and you do need to pick your patient. But actually, I think the first study that came about, of the first 80 people within the study, 90% of them had ACL healing. So really, really exciting evidence that's emerged. We've actually had, we're now on our second cross brace at Rains Park. The first one I managed, and he had full ACL healing.
That's amazing.
Amazing. It was really, really, really cool. So there's a 12-week approach. There's also an 8-week approach, and now there's a 6-week as well. We went into the 12-week, so you start at 90 degrees for 4 weeks, and then across the 10 weeks you slowly straighten the brace, and then you take it off 2 weeks later. So he was really, really lucky, and he at the end of 12 weeks had complete rejuvenation of his ACL. The other guy has not yet had his scan yet, so we're going to keep our fingers crossed. So that's the kind of the cross bracing approach now as well. So we have our sport and exercise medicine consultants, along with the surgeons, that can have, you know, a good look at the images and help to inform decisions as to which avenues the patients might go to for their interventions. Obviously, the physiotherapist will be the lead in terms of the rehabilitation approach.
And you'll be with them for quite some time, so you want to pick them well.
pick them well. And then within our wider MDT, alongside physiotherapy, we have our exercise physiologists as well. They are very, very advanced. I tend to use them maybe a little bit closer towards the end of rehab. Absolutely, they're amazing with end stage return, plyometrics, force decks, really helping people to achieve their strength and conditioning goals onwards. But I would probably consult them throughout the earlier stages.
Absolutely, and you can consult them throughout, and I think that's the big thing. It's a full MDD approach the whole way through, so a patient will have a plan from hopefully as soon as they've been diagnosed to this is where we're looking at your return to sport being, is that usually now 9-12 months later, and along the way you've got your physios that will be seeing you the most initially, but then you have all of this other input in there to help create the best environment for recovery and the most kind of optimal recovery for them. So your exercise physiologists, your strength and conditioning coaches who can work from day one. It doesn't need to be that everything else gets neglected. We used to say in rugby stuff that we tried to flip it on the head and go, okay, yes, you're 9 months here, you're 9 months off the field, and it's going to be pretty tough for you. But actually, what are the other areas that maybe we've neglected along the way, and what have we got the chance to work on here? Is that off-field game analysis? Is that in the gym shoulder strengthening work? Is all these different little bits that you can actually be doing alongside? It doesn't mean that for 9 months there's nothing, and I think that's where the beauty of the MDT does come in. Nutrition, obviously, really, really important. Looking at everything from recovery, fueling, making sure that you are still in that kind of nice energy balance, that you're getting the right nutrition on board. We can give very basic advice, but we have some fantastic nutritionists that we refer out to and that we work with, and ones that specifically do work with females as well, which we're really fortunate to have. So we'd always kind of utilise them, and soft tissue therapy and podiatry at the later stages. I think there is the role, regardless of male or female, there's the role for such a big MDT within ACL rehab.
And also talking about the trunk control as well. We even have Pilates, clinical Pilates instructors as well. So we pretty much can cover all bases.
Yeah, we really can. And
we're very lucky with the expertise. We have really incredible teams, and everyone contributes in very different ways.
Yeah, and like we said, it's not just what you put in terms of your strength and conditioning and your physio, but if your seesaw's not aligned in your nutrition, your recovery, your sleep, your hydration isn't there, it's not going to work. So it takes that kind of team approach, and it takes the education to get a positive outcome.
Going back to our sport and exercise medicine consultants, we have quite a strong women's health pathway at Brains Park.
Yeah,
you guys as well.
Bank,
and they can actually do a lot of hormonal testing, and they can make sure we've looked at vitamin D and done all of the kind of underlying clearance that we need as well to really help in that recovery.
So I think underpinning this whole conversation has been the sense that that there's a lack of research into injuries, not just for the ACL, but for women in sport in general, or that there's, research is primarily carried out on men. How important is it that there is more funding towards the treatment of sports-related injuries, specifically in women? Tash, I'll come to you first on this.
It's really important in my opinion, as women's sport is growing more and more, not just in the professional sense of the games. I think it was back in 2022, after the last Women's Rugby World Cup, 66% of the pre-team players were female. And that's incredible when you think about it, that 66% of the younger girls are actually, the younger players, are female. But we need to have a look then to keep the females in the game, to keep the retention of the female athlete. We need to work out why we get a drop off, and how we are going to retain them in the sport. So there needs to be the funding behind, and there is definitely more funding now than there was. So I know that FIFA have funded a big study recently, and that is on menstrual cycle, and that's been done at Kingston, and World Rugby have funded. I've got a lot of funding for female athlete, and not just the female athlete, but the female kind of the fan involvement and the player and all of those bits. So there is funding there that is starting to go down the right track. But I think as a research group, we almost need to take it back a step from doing all the, I said it to you before, I called it all the sexy stuff of the really intense, way menstrual cycle giving to injury and this and that and the other, and actually just strip it back to basics and go, okay, well, what is the injury prevalence? What are our standardized protocols for measuring injury? You've got the fuller consensus in rugby that is how injury is measured across rugby worldwide. And it is now used for women as well, but it's not women specific. And, even if you look at the game of rugby, and I don't know if you've been watching the World Cup, but you definitely should be if you haven't, because it is great. But it's a different game. It's a different game than men's rugby. If you look at the running stats on that, there's a lesser difference between forwards and backs of what is ran. There's less high speed meters covered. There's actually people doing the most high speed meters in women's at the moment are the second row, which is wild because you wouldn't see that in men's rugby.
No, the second row that I play with, they don't get out of third gear most of the time.
I know. So things like that it's just it's the same sport, but it's a really, really different sport. So if we're basing the injury prevention strategies even down to, and this could be a bit controversial to say, but even down to the rule changes on data that we're collecting from the men's game, how applicable is that to the women's game? And is that having a positive effect on injury incidents that we're seeing throughout the elite game, but also then knocked down into kind of the more amateur game and then down into community level rugby as well? So I know I went around the houses to answer your question there, but I think it's so important to get it both in the elite level, but also down at the ground roots level to retain the female athlete, not just in rugby, but to retain people in the sport, to then have the growth of the women's sport going forward from there.
I think if we think about that stat, that women are 5 to 8 times more likely to injure their ACL than a man is crazy. It's crazy. Like, we are doing a disservice to women allowing that stat to remain. It's not going to encourage women to, be active. And if we look at the wider implications of that, we need to empower women to be active. That's how we're going to become healthy. It's how we're going to fight disease. It's so important that we look at the bigger picture. And actually, even now, sometimes I think, we had the rugby game at Pure, and I thought, it's probably best that I don't just start playing rugby now because I don't want to tear my ACL. So actually, we really do need to invest in that so we can grow confidence for women, empower women, and keep them safe.
Confidence is such a big thing, isn't it? Having the confidence to step out onto the field and not think, oh God, what am I going to do?
So what would you say to someone who is feeling like unconfident about getting involved in sport?
I'd say find a sport that you like. It doesn't matter, whatever exercise it is that gets people moving and that gets people going. I'm absolutely all for it. If that's rugby, F45, swimming, dancing, whatever it is that's going to keep you active, fantastic. The thing that you enjoy doing is the thing that you're going to continue to do. But if you're concerned at all, seek professional help to get the input that you need to build the baseline for your body to be able to cope with the demands of that sport. So if it's football, if it's rugby, whatever it is, they've got really different demands. And if you don't know, don't necessarily just sit and watch TikTok videos on what you should be doing. Just get help from someone that does know that actually, you can have your biomechanics assessed and buy an S&C coach or buy a physio or buy somebody to go, actually, why don't we really address your quad ham differences or this bits and that and the other, and people that also can then talk about kind of the women's health side of things as well, because I know that is still a bit of a taboo subject that females will come into you and you'll say, okay, so can you talk about how's your menstrual cycle? And they're like, why is that relevant? Or, so I think just breaking down those barriers and going to somebody that can help you become fit enough for the demands of the sport that you want to do.
I couldn't agree more. If you're inactive and you're looking to get active, consult a professional that can just guide you along the way, because it's really important that you expose yourself gradually, that you implement enough rest and adequate recovery. And it's really unfortunate that a lot of people get excited about exercise. We, get really enthusiastic, suddenly start hammering, a new class or whatever. And then, we get a stress fracture or we get an injury, and then it completely disheartens you, completely discourages you. And then you end up, back to being inactive. When actually even just, one session with a physiotherapist or, relevant health professional can just help guide you that way so that you can introduce yourself safely.
Well, we saw that, didn't we, in COVID, in lockdowns, where everyone just suddenly became flipping marathon runners overnight. So,
yeah, we just had one of them in here talking about triathlon.
Something that I have found really useful, there is an app called Fit Our Woman. I don't know if you've come across that. I wouldn't want people to start worrying about their cycle, freaking out about their cycle. I don't want to do this at this time. What about that? That's really quite into the nitty gritty about it. But actually just getting to know your cycle is really, really important.
Yeah.
And there's a great app called Fit Our Woman. You can track your menstrual cycle. You can learn about the different symptoms. You can track your symptoms. You can learn about the different physiology that's happening at different times within your phases, and it can even give you advice around what to eat to kind of help manage your symptoms, and it can give you some interesting tips around how you can optimize your activity and exercise in different times of your cycle as well.
Yeah, having that knowledge of individual cycle, I'd say that's probably one of the key things for females, is having knowledge of how you feel at different stages.
The amount of people that you'll meet and they don't even know when their period was and what's phase 2. No one really knows, much about it at all. So
and when you actually track it and then go back to and you go, why? I know that I can lift that weight, and then you actually look and you're like, okay. Like some people will start really to see those bits, and you're like, why am I so grumpy? Or why? All these little things.
Same. I'm in this.
And it is nice, isn't it, to see, to just, and it. It doesn't excuse anything, and we're not saying that you're a better athlete at different stages, but seeing your own, I guess,
trends,
and correlations helpful, and it will also, it's quite self-empowering to then go, okay,
and it reduces the temptation to beat yourself up if you're not feeling great,
gotcha.
or not being as active, right?
Yeah, definitely will do so.
And you can kind of take little tips from that app as well. You might think, maybe, because evidence is a bit inconclusive, but maybe right now I am in, an area where a time that my neuromuscular control is particularly down. Yeah. I'm really going to hammer home the warm-ups and the cool-downs and the recovery.
Yeah, and like you said, it's it even goes as far as kind of nutrition and stuff as well, which, not just that app, but I mean, hormonal influence, and all of that's new research, or what we can do in terms of our hormones, in relation to kind of digestion and fueling and all of those bits. So that's new stuff that's all coming out, but does highlight how these sex hormones aren't just for reproductive health, but they are actually, as a female, they are important and they impact all of your body. So it's important and empowering for females to know that actually your menstrual cycle isn't just there for you to reproduce.
Okay. I think that's all we have time for today. So just only thing left to do is say thank you both for your time.
Thank you.
Thank you.